November being Mouth Cancer Action Month, here at Denta-Chinwag, we have put up this video to discuss what oral cancer is, the symptoms, the diagnosis, management and prevention. Oral cancer is one of the most frequent cancers globally. If diagnosed early, the chances of survival are up to 94%. This is very important. Mouth cancer is where a tumor develops in any part that make up the mouth. It may be on the lips, the gum, tongue, inner lining of the cheeks, roof of the mouth, floor of the tongue. It can also develop less commonly in the salivary glands, tonsils, and throat. What are the causes? Only God knows the causes of oral cancer, but there are risk factors that can increase the risk of developing oral cancers. Tobacco use of any kind, including cigarettes, cigar, e-cigarette, pipe, chewing tobacco, and snuff. Drinking alcohol excessively, poor nutrition, excessive sun exposure to your lips, a weak immune system, a sexually transmitted virus called HPV, this is a human papilloma virus. Who is affected by mouth cancer? Oral cancer is the sixth most common cancer in the world. Over 5,000 people in the UK are diagnosed with mouth cancer every year. More than 2 in 3 cases develop in adults over 55 and only 1 in 8 in people younger than 50. Men are 2 times more likely to be diagnosed with oral cancer, maybe because they tend to drink more alcohol when compared with women. I'm not so sure about this, but don't shoot the messenger. It is important to note that 25% of all oral cancer occur in people who do not smoke and who only drink alcohol occasionally. What are the symptoms? Symptoms can include mouth ulcers that do not heal within 2 weeks, unexplained persistent lump in the mouth or neck that do not go away, unexplained loose teeth or a socket not healing after a tooth extraction, unexplained persistent numbness or an odd feeling on the lip or tongue, ear pain, white or red patches on the lining of the mouth and tongue, difficult or painful swallowing, crusty or eroded areas on the lip, gum or other areas inside the mouth, a soreness or feeling that something is caught in the back of the throat, difficulty chewing, swallowing, speaking or moving the jaw or tongue, hoarseness, chronic sore throat or change in voice, a change in the way your teeth or denture fits together, dramatic weight loss. How do we diagnose oral cancer? Tests and procedures to diagnose oral cancer include physical examination to look for any abnormalities. This highlights the importance of regular dentist visits because this assessment and examination will be carried out by a dentist. A biopsy involves removal of these suspicious or abnormal tissues for testing. Once diagnosed, there are 3 main treatment options. Surgery to remove cancer cells with a margin of safety. Now, the margin of safety means, say for example, a cancer cell measured 2 centimeters. During surgery, the surgeon will have to take up to 3 to 4 centimeters just to make sure that all the cancer cells have been dealt with. Radiotherapy, this involves using high beams of radiation to kill the cancer cells. Chemotherapy is where powerful medicines are used to kill cancer cells. And lastly, you can also have a combination of all these options. So you can have surgery, radiotherapy and chemotherapy for the treatment of the oral cancer. What can you do to prevent or minimize your risk of getting oral cancer? There is no proven way to prevent oral cancer. However, you can reduce your risk if you stop using tobacco or don't start. If you use tobacco, stop. If you don't use tobacco, don't start. Using tobacco, whether smoked or chewed, exposes the cells in your mouth to dangerous cancer-causing chemicals. Remember, if you use tobacco, stop. If you don't use tobacco, don't start. That's a good one. Drink alcohol only in moderation, if at all. Chronic excessive alcohol use can irritate the cells, making them vulnerable to oral cancer. If you choose to drink alcohol, do so in moderation. Avoid excessive sun exposure to your lips by staying in the shade Wear a broad hat that effectively shades your entire face, including your mouth, and applying sunscreen lip product as part of your sun protection routine. Eating healthy, balanced diet that include fresh vegetables, citrus fruits, olive oil, and fish. You can also take an active role in detecting oral cancer early by doing the following: conducting a self-examination monthly using a bright light and a mirror. Tilt your head back, look and feel the roof of your mouth. Pull your cheeks out to view the inside of your mouth and cheek lining. Pull out your tongue and look at all surfaces, the left, the right, the top and the bottom, and also check the floor of the mouth. Look at the back of your throat. Feel for lumps in both sides of your neck and lower jaw. Contact your dentist if you notice any lumps or signs and symptoms. And most importantly, see your dentist regularly, because as part of your routine dental exam, your mouth will be inspected for abnormal areas or lesions. Thank you very much for watching. If you know anyone who will benefit from this video, kindly share with them. If you have any questions or comments, please put them in the comment section and I will answer them.